What is Fragile X syndrome? Fragile X syndrome is the most common inherited cause of intellectual disability, with males being more commonly affected than females. Typical features of Fragile X syndrome include large, protuberant ears, a prominent chin and forehead, a high arched palate, and, in postpubertal males, macroorchidism. The joints may be hyperextensible, and heart disease mitral valve prolapse may occur. Cognitive abnormalities may include mild to moderate intellectual disability. A 16-year-old boy is evaluated for attention deficit hyperactivity disorder. The parents state that the patient has always been impulsive and that teachers are concerned about his inattentiveness and poor grades. He also has mild intellectual disability. Review of medical records shows a history of gross motor and speech delay, for which the patient received physical and speech therapies during childhood. Height is at the 70th percentile, and weight is at the 50th percentile. Physical examination is notable for a long and narrow face, a prominent mandible, and large testes. There is hyperlaxity of the finger and thumb joints. This patient has mild intellectual disability and characteristic physical features of Fragile X syndrome. The condition is most likely due to expansion of a repetitive sequence in the FMR1 gene. Fragile X syndrome is an X-linked disorder caused by a trinucleotide CGG repeat expansion in the Fragile X messenger ribonucleoprotein 1 gene on the X chromosome. Excess trinucleotide repeats more than 200 cause hypermethylation, which silences the gene and prevents transcription of the associated ribonucleoprotein. Male individuals typically manifest the features of Fragile X syndrome, as in this case, whereas female individuals have a milder and variable presentation. Classic findings in male patients include physical features as seen in this patient. A long, narrow face, a prominent forehead and chin, and large testes are typical. These findings are usually most apparent after the onset of puberty. Hyperlaxity of the joints in the hand can also occur. Developmental and cognitive abnormalities, developmental delay, speech, and motor is common in infancy. Intellectual disability is also expected but varies from mild, as in this patient, to severe. Neuropsychiatric issues, features of attention deficit hyperactivity disorder, for example, inattention, impulsivity, and autism spectrum disorder, for example, poor eye contact, social deficits are common. Patients with Klinefelter syndrome 47, XXY, a sex chromosome aneuploidy, often have learning disabilities and neurobehavioral issues, and mild intellectual disability may occur. However, small not large testes are expected, and dysmorphic facial features are not typical. Prader-Willi syndrome is an imprinting disorder caused by loss of a paternally inherited allele on chromosome 15. Hypotonia and developmental delay are typical in early childhood, and intellectual disability and behavioral issues are common. However, in Prader-Willi syndrome, short stature and cryptorchidism, not macroorchidism, are typical, and hyperlaxity does not occur. A point mutation affecting collagen production can result in Ehlers-Danlos syndrome, a connective tissue disorder in which patients typically have joint hyperlaxity. However, this diagnosis would not explain this patient's facial features, large testes, and intellectual disability. Marfan syndrome is an autosomal dominant connective tissue disorder that may be caused by a splice site mutation within the fibrillin gene. Joint hypermobility may occur, but this patient's intellectual disability and macroorchidism are not associated findings. Fragile X syndrome presents with characteristic physical findings, for example, long, narrow face, large testes, intellectual disability, and neurobehavioral findings, for example, attention deficit hyperactivity disorder. It is caused by a trinucleotide repeat expansion in the FMR1 gene on the X chromosome, which causes gene hypermethylation and inactivation.